Taoiseach, as the Chief Medical Officer pointed out on Monday in a statement on contact tracing in schools, there's a substantially higher risk of transmission of COVID-19 in households compared to other settings, including schools. But as a result, families with someone who is immunocompromised will not now be told if their child is a close contact, exposing vulnerable people to COVID infection. Now, the CMO pointed out that while a public health risk assessment will be carried out to protect vulnerable children in special schools, no such assessment will be carried out if their brother or sister is a close contact in a mainstream school. How can this be right, Taoiseach? The policy needs to be looked at again, even until the immunocompromised people have had their booster COVID shot.
Thank you, Deputy Taoiseach.
I think we have to be careful, Deputy, that we keep on second-guessing, or some keep on second-guessing public health advice. The bottom line is that the schools have fully reopened safely after the summer break, and consistently from the outset of the pandemic, schools have operated on the basis of public health advice. And it's been consistent principle that the Minister of Education, Department of Education, operates in accordance with the public health advice that is given at any particular point in time. Now, NEFIT have, following a review, have recommended, as you know, from 27th of September, that routine contact tracing of asymptomatic close contacts among children in settings such as childcare facilities, primary education and social and sporting groups will no longer take place, with the exception of children in special education settings. Now, that is the advice that has been given, and the Department have issued updated guidance to schools on foot of the change. And the balance, I think, is correct in respect to that decision. It would be my observation of it. But we can't keep look, you're entitled to raise questions. I understand that fully. But there is a balance here. And I think
thank you, Taoiseach.
it's worked so far, I would argue, in terms of accepting the public health advice and dealing with that.